I pretty much overnight came down with a neurological disorder that within a week's time left me in the ICU, pretty paralyzed from the waist up. And the real ironic part about that is that I became the speech pathology patient in the bed, receiving services, unable to communicate, thoughts of suicide, thoughts of thinking, why did they keep me alive? If this is going to be my life now, this is not the life I want to be living.
This isn't the work that is immediate results. This is intentionally slow, gentle. You said the power of the pause. It's beautiful. This is slow, gentle work. And part of that is healing in itself, to go slow and be gentle, because that is the opposite of what happened with medical trauma.
I have my toolbox in my back pocket that I rely on every day of, okay, deep breaths. I am safe. I am loved. I'm going to be okay.
Welcome, everyone, to the Medical Trauma Support Podcast. And today I have Vanessa Abraham here. Vanessa is a speech pathologist, an author, and an ICU survivor. Vanessa, welcome. I'm glad you're here.
Oh, you have no idea. I've got goosebumps right now. I'm so excited to be here. I have had many sleepless nights in the past week, just brainstorming this conversation in my head. So I just am so excited to dive into this conversation with you. So thank you.
Yes, thank you. Thank you for being here. And, I gave a very short little intro for you, but do you want to tell us a little bit more about who you are?
Yeah. So like you said, I am a speech pathologist. I've been practicing for about 15 years or so. And I work in the school setting as a speech language pathologist, working with kids anywhere from mild impairments to more severe complex impairments where they're maybe nonverbal, using augmentative communication devices to communicate. So that's where I'm at with my career. In 2019, I pretty much overnight came down with a neurological disorder that within a week's time left me in the ICU, pretty paralyzed from the waist up. Eventually was given a tracheostomy and intubated and given a tracheostomy, tube fed, all within a matter of a week's time. And the real ironic part about that is that I became the speech pathology patient in the bed, receiving services, unable to communicate, using every modality to communicate, from eye gaze devices where I would look at a word, blink my eyes to communicate, all the way up to using text to speech, eventually a passing-ear valve on my tracheostomy that allowed me to properly phonate and actually verbalize. Also tube fed and worked on swallowing, all areas that as speech pathologists that we work with. So I've really been on both sides of the equation now, and I'm here to talk about my healing journey and what I've done to support myself, support my nervous system, and hopefully give your listeners some pieces of advice on what helped me, and hopefully they can learn from my experience as well as both the patient and the provider.
Yeah. Oh my goodness. Yeah. That just is so hard. Just, yeah. Thank you for sharing that with us. You talked, you and I have talked before, and you have talked about how challenging that experience was and the medical trauma that came from it. And I'm also thinking about the conversation that, I've had many times, and I think you and I also talked about it. And it's like, when we're going through the really hard experience, like when you're there in the hospital, that's not when you process the emotion around it. It's like you're in survival mode. And then once you're home and you're in a place where you feel safe enough, that's when it's time to do the emotional work. And I'm curious about your experience of that.
Yeah, the real healing started when I got home. You're so right. When I was in the ICU, and then after I left the ICU environment, I was there for a month, and I went from there into rehabilitation units, 2 different ones. And I remember being there and wanting to go home, but also being scared to go home, because then I would lose the comforts of having nurses by my side every day, suctioning me. All of that was going to fall on my husband, which terrified me for his sake. But I also knew that the real healing was going to take place at home, where I felt safe, where my body, my nervous system felt safe and comfortable. But I also found out too that when I got home is where the depression sat in, because I'd walk through and I remember this like it was yesterday, walking through the front door of my house and realizing, wow, 2 months ago, I was this active, healthy mother raising a toddler, living the best life ever. And now I walk through the door, a completely transformed human being, tube fed, barely able to walk through the front door, having my husband there basically help me through to the couch, and realizing that I am not that same person. So then that's when I embarked on the new part of realizing, wow, this is a whole new kind of trauma that people live with that's not being discussed. And that's what led me to start understanding PICS, post-intensive care syndrome.
Can I for 1 second, Vanessa, because I think what you said, just your description that you just shared, is so important for people to understand, is that you don't just come back like you were when you left for whatever medical experience has happened, and the grief and loss and anger that come along with that, to remember what it was like when you left and how different things are when you come back. And I just want to take a minute to validate that. And for people listening who may be in that space right now, to know that they're not alone and feeling a lot about that, feeling the depression, that deep grief. It is a loss of who you were before.
Yeah. The grief, the loss of self, the loss of identity is huge. And as a provider, 2 months before that, I didn't realize that. It took me being the actual patient to realize there's a mourning process that we're going through. They are mourning. They're going through the grieving process of losing their former self. I couldn't drive, definitely couldn't go back to work, much less eat, get myself to the shower, dry my hair, wash my hair. I couldn't be the mom that I wanted to be. And that was the hard thing for me, is I wanted to go back to putting my daughter in the stroller and going for a walk. That loss of self and loss of identity as a mother, as a speech pathologist, as a wife, it was gone like that. Mm-hmm. And that grief that I went through, and honestly, it took years to get past that loss of identity, and the depression was off the charts. Thoughts of suicide, thoughts of thinking, why did they keep me alive? If this is going to be my life now, that's going to be the mom that's tube fed, that can't sit around the dinner table with their child and eat a meal, this is not the life I want to be living. So for me, it was a real big awakening that this is a new kind of trauma. And as clinicians, there's such a huge buzzword out right now of being trauma informed. And I started to realize that the world that I was living and practicing in is not as trauma informed as they really should be, because medical trauma and PICS, I have talked to hundreds of professionals in the past 6 years. It's been 6 years since I was in that situation. A few here and there have heard PICS. Most people, when I say, have you heard of PICS, post-intensive care syndrome? They say, no, I've never, what is that? And it crushes me, but then it also gives me hope. And I think, okay, I need to educate people. I need to people
right.
to realize that medical circumstances are traumatic. PTSD is real. It's real. Flashbacks, insomnia, depression, anxiety, brain fog, all of these things are legit. We are not making things up. We are not exaggerating. These are real things. Seeing ambulances, certain sounds, things on TV, triggers.
Yeah. And I'm wondering if, for the listeners, because you're right, not a lot of people have heard of PICS, if you can talk a little bit more about what that is.
So PICS has everything to do with the cognitive impairments, the depression, the anxiety that ICU survivors go through. I equate it to not medical, but you have a veteran coming home from war. They have all those flashbacks. They have the anxiety, the depression, sight, sounds, all this sensory stimuli, the brain fog, all stemming from the trauma that we went through. For me personally, my trauma was trying to breathe again. being suctioned, trying to breathe through all of this phlegm and secretions that were coming up, trying to vocalize again, waking up and a speech pathologist looking over my head, ready to assess me for voice and swallowing, and realizing, wait, I'm in the bed. Learning to move my limbs again, learning to just go, this is all massive trauma placed on us. Some people are in comas and they experience delirium. This is all trauma that we've had to find ways, different therapy modalities, whether it's, hypnosis, EMDR, ACT therapy, CBT, all these different therapy modalities to help us get through this trauma, because and sometimes some people just experience a little bit. Sometimes people experience a whole lifelong journey of navigating PICS, but it's real.
Yeah. And I think, for people that are listening that maybe aren't the ones that have experienced the medical trauma, but if you have someone that you love, or you're a provider, a medical provider in the ICU, I think this information is so important. And like you said, before your experience as the speech pathologist, you hadn't realized that the mourning that happens afterwards. And so I think you sharing your story and talking about it like you have been is so powerful and is what can create change, because we need people who have not experience the ICU, but who are caregivers, who are medical providers, to try to comprehend what people are going through after they have been in the ICU.
You brought up a really good point too that I want to go deeper dive into, is this thing called PICS family, post-intensive care family. The family, oh goodness, they go through a lot too. My personal story, my husband, he went from working full time to a caregiver overnight. He stopped work for 6-7 months or so. And he lost his identity. He went from working full-time husband, father, to now caregiver, helping his wife and the mother of his daughter, helping her get in the shower, drying and washing her hair, tube feeding her, taking her to medical appointments because she couldn't drive. So his identity was lost too. And the caregivers and the family need to realize that what they're going through is real as well. And it's so, so, so important to be talking about these conversations. It's so important. It really crushes me to see patients leaving the ICU and nobody's having these conversations. Here's a true story. When I left the ICU, I was equipped with all of the necessary medical equipment. They sent me home with a shower chair, everything I needed for suctioning, everything I needed, all the medical equipment for tube feedings and cleaning the wounds and everything I needed, except one thing: mental health referral. They totally missed the boat, in my opinion. I remember coming home, insurance shipped cases and cases and cases of tube feed material. Liquid tube feeding. And I looked at that and I just thought, what good is all of this? As a provider, as a speech pathologist, I thought mental health is not being addressed, because what good is all of this equipment if your patient doesn't want to live another day, another minute? But all this money was spent on all of this equipment for me, which was great. I needed it, but I didn't want to live.
Yeah, I think like what you just said is so crucial. And often that the mental health care that is so needed for everyone who has been through that experience, mental health care is a crucial piece of the care that we need afterward. And for anyone listening, like if you have any, say something about it, right? If you're a medical professional and you're listening, take the seed, plant it, see what you can do to start to support clients with mental health referrals. I know oftentimes there are social workers in hospitals, and the social worker should have a list of resources, mental health resources. But I think that's why we have this huge medical trauma epidemic, right? Is that there are millions of people walking around with medical trauma. A lot of them don't even know that what they're dealing with is medical trauma. But we all need mental health care when we've been through something really hard like this?
Yeah, I was very fortunate that the hospital I went to was able to recognize it. They were able to see, wow, a week ago you were this and now you're this and you're going to need help. And so they referred me to PICS support groups. But I was the rare 1% that I got that referral. Most people, and it took probably a month before one of the doctors from the hospital called me back in and just said, hey, how are you doing? And they gave me like a cognitive assessment, which I passed. The cognitive assessment, I was able to answer those questions, but I was so deeply depressed. And I'm sitting in the office with her crying. I remember it like it was yesterday, crying. And she's like, how are you? I said, I don't want to live. I have a child at home, but this life is not what I signed up for.
Yeah.
And that's when she was like, there's this thing called PICS. And I said, she's like, have you heard of it? I said, no, what is it? So then I took a deep dive into it. And to this day, I'm so grateful because I would be one of those people walking the streets right now out in the community, not realizing why I'm dealing with what I'm dealing with because no one told me about it. So I think ICUs upon discharge, or even when you're in the hospital, you're admitted to a hospital, kids, families, NICUs, parents need to be having these, or social workers, doctors, physicians, any therapists need to be having these conversations when these kids go home, when these parents take their babies home, when, spouses take their loved ones home of, hey, your loved one may experience this. You as a parent may experience this. This is normal. There's help out there. There's resources. Here's some websites. Here's some, brochures. Here are some support groups. I attend many support groups for PICS. They need to be provided with the resources and the knowledge just so they don't go home and the loved ones look at their spouse or their child and they wonder, why are they anxious going back to doctor's appointment? Why are they behaving this way? Well, there's a reason for it.
Yes, it is. And that's the thing that I think is so important for people to understand is that is a normal human response to going through something really hard and excruciating. It is normal to have those feelings. It absolutely disrupts life. It is so hard, but that's the human response. And what it is saying is not that there's something wrong with this person, but that they need support.
Yes.
Right? They need support. They need support groups. They need community. You and I have talked a lot about community.
Mm-hmm. Oh yeah.
Big fans of the importance of that. But they need community. They need to know that they're not alone and that it can feel so isolating. And it can really feel like you are the only person because you see the other people in your community going about their lives, right? Like everything's fine. And here you are in this dark place. And so when you can find community that knows what it's like, you're like, oh my gosh, so there's nothing wrong with me. I've been through this hard experience and I'm experiencing these similar things to these other people who've been through this hard experience. And the beautiful thing too is in these communities, you're going to find people all along their healing path, right? So you're going to see these people who can find joy again. And you're like, oh my God, I don't know if I could ever feel happy again. But this person, they feel happy. There's joy there. And so, I'm sorry. I went off on a tangent there, but
Oh, you're just feeling everything that I have in my heart because the community is what got me through it. When you're going through critical illness and coming out of the ICU, you feel isolated and alone. I remember coming home from the ICU and I had so much support. Everybody's coming to your house, calling, texting, helping. And I knew in my mind, this is going to fade. The newness of Vanessa being paralyzed and tube fed and just fighting for her life. Everybody else is going to go back to their life. They're going to go back to work. They're going to go back to being moms and professionals. But Vanessa's going to stay here in this dark, dark, dark place. And that's what happened. And that's where I felt even more isolated and alone. And the depression just grows from there. And I was very fortunate at that point in time when everybody else's life kind of went on is when I found my support groups and I was able to log into this group every week. And that was my community. Those were people, just like you said, they were on every stage of the recovery journey. Some people fresh out of ICU, some people many years out of ICU. And I was able to come to these groups and pour my heart out and say, this is what I'm feeling. And they would all look at me and say, yep, been there, done that, lived it, or are living it still today. And then I felt like, wow, okay.
Yeah.
I'm not crazy.
Yeah. And I want to encourage people that, to find those groups, right? So there are a lot of support groups that are specific to what somebody has been through. Like, so you shared that there are PICS support groups. So, but if you can't find that or it's not a fit, we have through medical trauma support a community. So, we have a membership community, and within that community, we have weekly peer support groups, and we have people with all different experiences. But the common, experience is that, they have experienced medical trauma, and it may be as the person who's experienced it in their own body or experienced it as a caregiver or, parent. So I just want to share that for anybody who's listening and is like, well, I don't know where to go. Like, yes, I want support. Where do I go? And so that is an option. And Vanessa, like you said, for somebody who has the experience of having been in the ICU, there are PICS groups.
Yeah, there's a couple of them that I know of. The ones that I attend they're bigger, they're more well-known, established groups. One of them's at Vanderbilt, other one's in Pittsburgh, Mercy. They meet weekly. Vanderbilt even has a PICS 101 class that they offer a couple times a year. It's wonderful. It's such a great, I went to it myself, just talking about PICS and what it is. And it's a 101 class, so it's very introductory, but gave me so much knowledge as to what this is all about, how I can help myself, what it does to the nervous system, and one thing that I learned at the class that just really stuck with me is that ICU trauma survivors, their brain structure often looks like we've had a traumatic brain injury. Some people, it's so severe that it's almost borderline Alzheimer's dementia because of the trauma that's inflicted on our brain and nervous system. It's real. So these support groups, for me, I tell everybody, people ask me all the time, what do you recommend? And I say, find your community. Get your support, because not many people understand.
Right. And then also, you've talked about the nervous system. And again, I think that's why we get along so well and have so many good conversations, is there's the aspect of community, but there's also the aspect of understanding that your nervous system needs some extra love after an experience like that. And that's a big part of the healing journey, because after that experience, our nervous system is kind of stuck on the danger. Like, everything feels like danger. And there are things that we can do, both just learning about the nervous system and learning about our own unique nervous system and what it feels like out in the world. And there are also practices that we can do to, I'm going to use the phrase heal the nervous system, but, really practices that can help us learn how to regulate ourselves again and just start to find that sense of safety again in our own bodies.
I have my toolbox in my back pocket that I rely on every day of, okay, deep breaths. I am safe. I am loved. I'm going to be okay. Because
Vanessa, let's do it. So how about I bring in a breath and you bring in your mantra? Because I love, that's so beautiful. So let's start with straw breath. And I've done this on other podcasts for people who've listened to those, but I'll explain it again for new listeners. So you're going to breathe in your mouth, in your nose for a count of 4, and you'll breathe out of your mouth for a count of 6 to 8, with your lips pursed as though you're drinking from a straw. So we'll go in for 4 through the nose and then out.
I am safe. I am loved. And I'm going to be okay.
I am safe. I am loved. And I'm going to be okay.
I like to do that whenever any type of memories, flashbacks. You know, when I'm driving down the street and I see an ambulance, that's one of my triggers. And I have to remember I'm safe. I'm going to be okay. That ambulance is not here for me. That's behind me. I'm safe. I'm loved. I'm going to be okay.
That's so beautiful. And so we did breathing and mantra. And what we also both did was self-touch. That can also be so grounding, just to take your hand and touch your heart, or maybe even doing some of the kind of self-havening where you take your hand and you give nice firm pressure from your shoulder down your arm, giving some nice pressure on the joints, like on your elbows. And you can even do both hands at the same time.
And I love these strategies. They're free. You can do them just, you know, when you're at work, when you're juggling kids, you can just give yourself a little, you know, a minute or two just of self-care, of self-love. Comfort yourself, comfort those inner kids that are scared. It's so important because we're so hard on ourselves. I'm a mom, and the pressure, the guilt, everything with medical trauma that we go through, to be able to stop and pause, take that breath and realize, I'm going to be okay. I'm safe. I'm doing the best I can, and that's okay.
That self-compassion, we've talked about community and nervous system practices. And self-compassion, which is not easy for everyone, right? We're all starting where we're starting. So not everybody can easily step into self-compassion, but that when you can, that is so healing. So we've already talked about like these, community, nervous system practices, self-touch, self-compassion. These are such beautiful pieces of the healing pathway. And I wanted to know, Vanessa, if there are some other things you've done that you would share with the listeners as part of your healing.
I love just being out in nature. Truly, just stepping outside, grounding my feet in the earth, taking those deep breaths, pausing, the power of the pause. Before I react, as a mom, there's so many times that I just want to, and I get so frustrated. Clean your room. You know what I mean? Do your work. Pause. You don't have to react quick. Just pause. Take a look outside. Go look at the trees. Count things that you can see, things that smell good, what colors you see. Look at nature, look at beauty. Beauty in nature has always brought me down. That's just me. But me to just be able to step outside, have that fresh air, cool, crisp air can really help me. It really takes me down sometimes. Obviously community is a big one. And what we just did was a beautiful representation of what I try to do all the time, that Vanessa, you're safe, you're calm, you're loved. Pausing. You don't need to react right now, Vanessa. That ambulance is here for someone else. Gratitude. It's not easy. You said it a few minutes ago too. These all are very challenging tasks, but they can be done. And what I love about them all is that they're free, We can do these at any point in the day.
Yes, they are. And I think, it's so important because we live in the society that wants immediate results from anything we do. And this isn't the work that is immediate results. This is intentionally slow, gentle. You said the power of the pause. It's beautiful. This is slow, gentle work. And part of that is healing in itself, to go slow and be gentle, because that is the opposite of what happened with medical trauma. Traumas happen really fast, and they're overwhelming, and they're confusing. And so as part of the healing, it is slowing down, being gentle with yourself each day, having these practices that you do. And you'll be so surprised when like 6 months later, 3 months, whatever it is, you have an experience and you respond differently. And it's almost like sometimes you almost like miss it, and you have to back up and go, wait, walking into the doctor's office 3 months ago just took every ounce of me, of my power to walk into this office and stay here. And this time I walked in, and I felt my heart pounding, but I was able to sit in the seat. So you start to notice these shifts that happen. And then it's almost like this like beautiful snowball effect of you start to feel better. And then you start to feel even better. And then you feel better and you engage more in your community. And then you get more goodness back. And it's really, I just think of it as like a snowball. Once things start to get better, it starts to pick up speed and you really start to notice big changes.
You start to notice because your nervous system's coming down a few notches, not even a few notches, a lot. As ICU survivors or medical trauma survivors, we are always in a state of fight or flight, going back into medical doctor appointments, always being afraid of relapse. Your mind is always just fight or flight, sympathetic nervous system, go, 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 fear, anxiety. You get on this hamster wheel of all of this negative cycle of, like I say, the anxiety, the depression, the fear of relapse, I've got to go relive this, and goes back to this doctor appointment. Then I get referred to another doctor appointment. Then I got to, go through the insurance thing, and it's all sympathetic nervous system. And then everything that we talked about today is going to hopefully transition you to that next level where when your nervous system is calmer and more regulated, you really can heal. You can focus on healing treatments and your body can rest. That's another thing that's so important, just getting proper rest. As ICU survivors, we often deal with insomnia, so we're not sleeping as we should be. And I think if you're able to kind of tame your nervous system down a little bit, maybe you can get into a better sleep cycle too.
Yes. Yeah. There's that. And then there's also nightmares, right? We know that nightmares are a common experience of trauma. So there are a lot of different things that can disrupt sleep with medical trauma. And, the more we can try to slow down and be with ourselves, it's helpful for the sleep. But also I will say one thing that somebody told me when I was really having a hard time with sleep was, give yourself a break and just tell yourself, I am resting. Even if you're not able to fall asleep, because it can be so frustrating because you hear sleep is so helpful. If you want to heal, you need to sleep. And then to be laying there and think, I want nothing more than to sleep and I cannot fall asleep. So somebody who was a really important part of my healing, he said, listen, just realize you're resting. Maybe you're not asleep, but you are still resting. And so that can kind of take some of the pressure off because I don't want to be the same person that I heard, different people I heard so many times saying, sleep, you got to rest. It's like, I'm doing my best. I'm trying to sleep.
I know, but you're resting. Like you said, you're still, you're not in motion. And that to me I'm guilty of that, where I always feel like I need to be in motion. And that's kind of how I've sadly navigated some of the trauma, is always feeling like if I'm not productive and I'm not doing, then I'm not worthy. And that's been bad. And I've learned that about myself. And that's another thing too, is kind of addressing some of those patterns that you get into when you're trying to heal. And like I said, I was like post-traumatic busy. I got to be busy to prove to everybody that I'm okay and that I can survive this. And that backfired.
Well, and that's also flight. So that's also a symptom of flight, is to be busy because you're trying to flee from
the drugs.
And so again, we can have some self-compassion and be like, oh, you're doing such a good job, body, trying to keep me safe, but we're going to slow down. We're going to slow down. If it's just for this next minute, if the minute is all I can handle, then we're going to take 1 minute of slowing down and then it'll slowly build.
And reminding myself too that this can wait. This task that I feel like in my body right now that needs to be done, it really can wait. It's not going to be the end of the world if I don't get to it for another hour or even tomorrow.
Mm-hmm.
But that goes back to the pressure that we put on ourselves and the negative cycles that we get in when we're trying to heal.
Yeah. And I think it's also important because we've talked a lot about how good it feels to start to heal, but also to really acknowledge that it's also not easy. It's not easy. And especially if you're somebody who you haven't slowed down a little bit yet, you're going to feel some stuff. You're going to feel sensations and emotion. And so to really take it easy, and oftentimes we really do need a therapist or somebody who can help guide us in the early days and be with us. You know, we talked about community. That is crucial. But oftentimes in trauma, we felt, even if there were people around us trying to save our lives, right? They're there. We feel so utterly alone in it. And so to have somebody who can be with you, especially at the beginning when you're starting to feel these things, so you don't feel alone with it anymore, that's so important too. And so if you're listening and you're just at the beginning of this and you are able to, it can be helpful to find a therapist, or if you don't feel comfortable with a therapist, maybe even a peer specialist, you know, somebody who has been there, has been in the hard places. Even if you're involved in your church community, you may be able to find someone there. But really, you need to find somebody who knows how to sit and hold space and is not going to make it about them. They're going to hold space for you. So as you start to feel the things, the emotions, the sensations, all those feelings, that you see that you're with someone. And that can be really healing too.
Yeah, you bring up a very good point of finding therapists to talk to. There's, sadly, even in today's world, there's still a stigma of, I don't need a therapist. I don't need to talk to anybody, especially for men. And it just breaks my heart that men feel this, need to suppress their emotions, and even in today's world. But it's so important. Our group through Vanderbilt, the support group for PICS, they do have peer supporters in that group too. And that is a really good point, that maybe you just need somebody else to just talk one-on-one that's kind of been there.
Yes.
And whatever modality works for you, find that modality and stick with it. Our support groups, there's women and men, varying disabilities of, all sorts of things. Long COVID, from what I have, Guillain-Barré, you name it. And just having that support group and having somebody to lean on and having people to call when you get in those dark valleys.
Yes.
Hey, I'm having a really hard day. Can you just talk to me for 5 minutes? Can you tell me about your kids, or just distract me? Something, I don't know, just having somebody that will be there, or a group of people that will be there for you, is sometimes the difference between life and death for some people. That's scary.
It really is. And the other thing I'm thinking of, Vanessa, is you have written a book, and I want people to know about it, because books can oftentimes be a resource that people can lean on too. And so can you tell the listeners a little bit about your book, and also how they can get in touch with you? Because there may be somebody listening who has recently come home from the ICU and they don't know where to start. And can they reach out to you or follow you somewhere?
Absolutely. So my book is called Speechless. And in my book, I kind of dive into more of my medical story, as a speech pathologist, what I went through in the ICU, what rehabilitation looked like for me, what coming home looked like for me and my family. And then I tie it up at the end of the book about community and the importance of community, what the community did for me. And I mean community as far as my nurses in the book. I still talk to them. My doctor in the book wrote the foreword of the book. I still talk to him, and what he continues today, 6 years later, to do for me. What my family, my husband went through, what they've done for me. The PICS support groups. It's the whole picture of, from before I got sick, and everything from using an eye gaze device and not being able to communicate, to the rehabilitation journey. So it's pretty extensive, but they can be found on Amazon. So if you go to Amazon and you type in Speechless, Vanessa Abraham, the book will pop up there. They can also follow me on socials to get any updates about anything medical related, speech pathology related. And Instagram, it's speechless_SLP. On Facebook, it's speechless SLP, and SLP stands for speech language pathologist. I am also on LinkedIn, Vanessa Abraham, and then they can also locate me on my website, which is ANEU, ANEU healing, HEALING.com. So different ways to connect with me. Yeah. So I'm excited about the book, and, I'm very, very motivated about talking about PICS and speaking about PICS, and making sure people don't feel alone in this journey, because I've been there, I've lived it, and truly I don't want anybody else to ever live in the dark places that I have been living. So I'm here for anyone and everyone.
Thank you so much. And I will put all of those links in the show notes too. So for anybody watching, you'll be able to find the links and click on those to be able to access Vanessa and all your wisdom and be able to read your book. And then, before we end this episode, I want to ask you if there's anything that you want to leave the listeners with.
Oh, we had such a good conversation. I don't know what's left. If anybody is interested in any support groups, definitely reach out to me. On my website, you can email me through Instagram. You can connect with me. But if anybody is in need of any support group information, I can lead them in all the right directions to find support, because community is everything. That's my big takeaway. You're not alone. There's ways to heal your body. It takes work, yes, but there's people out there. There's people like you and I, and oh boy, I could put you in contact with a whole nother laundry list of more people that would be out there willing to connect with you and hold your hand through any of this. So you're not alone.
Yes, that's so beautiful. That's so beautiful. And I want to also end it again with talking about community. The medical trauma support community membership community is now open. And I will also share a link to that. And you can also find it on the website, which is medicaltraumasupport.com. And you'll see a link that is the Befriend Your Body community. So thank you, Vanessa, so much for being here. It was so great to talk to you. And thank you to the viewers and listeners for being here as well. And thank you.
Yeah, thank you.